All right, so hi everybody. Thank you very much for coming to join us today. This meeting is being recorded to then be played on social media and on our YouTube page for those who couldn't be here to watch it live. Today we're discussing the COVID-19 myths and realities, and we have members of MGH Charlestown, of Charlestown New Health, and of the Charlestown Coalition here with us to discuss the different myths and go over the realities of those topics.
Right.
And I can.
We're going to introduce ourselves. Should we go ahead and do that, Sarah?
Oh, right. So I'm Sarah Avery. I'm the health educator at MGH Charlestown HealthCare Center, and I'll pass it off to you, Jim.
Oh, no problem. I'm Jim Morrill. I know many of the people on the call, but possibly not all. I'm the medical director at MGH Charlestown up at 73 High Street.
And hi, I'm Anne Maricheri-Boga. I'm the medical director at New Health in Charlestown, 15 Tuff Street.
I'm Sarah Cole. I oversee the Charlestown Coalition, which is part of the Center for Community Health Improvement at Mass General.
Excellent. Okay, well, so yeah, do you want to, Sarah, do you want to introduce what we're talking about now?
Yeah, absolutely. So the myths and realities that we will be discussing, we'll go through what COVID-19 in Charlestown looks like, the available resources in Charlestown, what it's like for seeking healthcare right now, public health mixed messages that are going back and forth from when COVID-19 first came about to now, healthcare finances, as well as reopening moving forward. And I'll pass it off to you, Jim.
Okay. So our first thing we kind of wanted to address for people, and many of these myths are based on things that we've heard in the clinic, that Sarah Avery has heard as a health educator, that Sarah Coughlin and her team have heard as a community coalition. And as Sarah Avery said, there are certain, buckets of myths that kind of come our way. And the ones that we thought we'd start with are some of the medical myths about COVID-19, and or at least areas of uncertainty where some myths exist and abound out there in the world. And the first one is this idea that it's really only certain groups of people that get really sick from COVID-19, that there are certain certain groups that are affected and other groups that aren't affected at all. And we're here to tell you that while there are important risk factors for getting severe disease from the novel coronavirus, severe COVID-19, anyone can get really sick from it. It's highly variable from person to person. I'll just mention a few of the risk factors that seem to give a higher risk of having severe illness. Those do include age, over 70 and especially over age 80. Those include chronic conditions such as cardiovascular disease, like coronary artery disease, congestive heart failure, pulmonary disease such as COPD, asthma, emphysema, chronic bronchitis, actually diabetes, which affects the immune system and seems to affect susceptibility to severe COVID-19. So chronic illnesses in advanced age are definitely among the risk factors. I think other important risk factors are being on medications that suppress your immune system. There are many people out there who are on immunosuppressive or immunomodulatory medications to try to manage other conditions like autoimmune diseases, rheumatoid arthritis, lupus are just a couple of examples. And so those are also risk factors. So there are well-defined risk factors, but I can also tell you we've seen in the hospital where Anne and I both have done some work, and in some of our respiratory illness clinics at MGH, where MGH has set up places for patients to be evaluated for the possibility of COVID-19, that young people can get sick too, that it really seems to be highly variable. When I was in the hospital recently, I had a 92-year-old gentleman with cardiovascular disease, and his chest X-ray looked really pretty bad. Seemed to have quite severe COVID-19 visually on the chest X-ray, but he was doing fine. His oxygen was okay. He was actually, when I met him, he was sort of on his way toward getting out of the hospital. He was doing a jig in the hallway with the nurses and working with physical therapy on his way back to his assisted living facility. So there are things we don't understand about people's susceptibility to severe COVID-19 that go beyond the traditional risk factors. So that's one kind of message we wanted to get out there. And Anne, I'm sure you have some things to add. Anne is a family practice doctor who takes care of kids as well.
Yeah. Thank you, Jim. I just want to mention that I think we've all heard in the news about the multi-system inflammatory syndrome in children. While it is thought that most children who may become infected with COVID-19 will do okay and not have any serious illness, what we're finding is that a few weeks later, there may be an inflammatory response in their body related to the COVID infection that causes some pretty serious complications. So, you know, we're still learning every day about this illness, and we're not always sure who's going to be impacted and how. So it's hard to know exactly, and we're trying to really encourage people to really take it seriously. Like, we just don't know who's going to get very sick with this illness.
I'll mention one more message that's related, which is the time course of COVID-19 can often be confusing and surprising. And one of the things that we've noticed both in the clinic and in the hospital is that there is a turning point, and this has to do somewhat with the immune response to the virus. Somewhere around a week to 8 to 9 days out after symptoms first appear, when for certain patients, and again, sometimes it's the traditional risk factors that I mentioned, sometimes it's more mysterious than that, they get really sick really fast. And there's kind of an inflection point, and it's often greater than a week out from the first onset of symptoms. And so that's something for everyone to be aware of. If someone has tested positive for the illness, there's really quite a bit of need. And I would say this is true across age groups and across different medical histories, a need to remain vigilant throughout that time period. And then usually what we find, and there are exceptions to every rule, is that when people get out beyond 10, 11, 12 days, which itself tells you how long this illness lasts and how severe it is. But at that point, people really seem to be over the hump and generally on the mend if they're doing better. Let's say if they haven't required hospitalization by that time, or even if they're in the hospital and we're watching them in the hospital. So wanted to mention that as well. So moving on to some of the other areas of uncertainty, controversy, and mythology. One common belief out there is that for sure, if you've had COVID-19 in the past, you are definitely immune and can't get it again. And I think we just wanted to make the point here that we don't totally know that there is some science that points in the direction of durable immunity after one has had COVID-19. But that is not certain. That is actively being studied by scientists and physicians around the world. And there are some indications that may be the case, but it's not proven. And I don't know if there's anything more you want to mention.
No, I concur. I mean, we don't really know how to interpret all the testing, and I know it's being advertised about antibody testing and getting yourself tested, and there's ways to do it. We really don't yet understand what the results of those tests mean and how those antibodies may protect us or not. So we have to be really, really cautious and thoughtful as we go forward with the whole question of the antibody testing. I know we all want to know if we've had it, so we're all just waiting, chomping at the bit to get this antibody test and to really know whether or not we've had it and whether we're safe, but we just don't know yet, so we need to be cautious.
Yep, antibody testing is I'm glad you brought that up, Anne, because if there is durable immunity, it's likely to be mediated, at least in large part, by antibodies, which are, as many people on the call will know, proteins, immune proteins formed by the body in response to an infection that last, and there's memory of them. So there are cells that can produce a whole lot of them when they're challenged again with the same antigens that are on proteins that are on the infectious agent, and that can lead to an ability that is like kind of remembered by the body to kill this same organism if it comes back into the body in the future. And that is a mechanism of immunity for many illnesses that we know about. And flu strains change every year, but stimulating the immune system to create antibodies to influenza is what makes the flu vaccine effective. Ultimately, that's what will make a vaccine to COVID-19 effective when a vaccine eventually is produced, hopefully in around a year's time and change from now. But in people who have had COVID-19, natural immunity from having the infection through antibodies is what we think could give durable immunity. And so therefore, the test everyone's talking about is antibody testing to know if you have those antibodies. Even if you're not sure whether you had COVID-19 or not, to know whether actually maybe you did, that cold that you had back in February that was actually pretty mild, could that have been mild COVID-19, and could you now have antibodies? Do those protect you? There are a lot of tests out there. We don't know which ones are the most accurate. And as we were saying a few minutes ago, we don't know for sure if the presence of those antibodies means that you're immune. And if so, how long you're immune. So that is an area of uncertainty. And so if people tell you if you've had it, you definitely can't get it again, that is not a sure thing. Okay, and maybe Anne, do you want to take this third?
Yeah.
Third point.
So, we all know that one of the issues with the COVID-19 and the pandemic is that it was hard to get enough testing kits for everybody. And so we were pretty slow to ramp up. And that's a reality. That's really a reality of our situation. And so what happened in Charlestown, the comment here is Charlestown does not have many cases of COVID-19. I think the reality is we just don't know because we haven't had enough testing until recently. So we had one of the lowest rates of testing across all of Boston. So to that end, I want to give a lot of credit to Mayor Walsh and also the governor. We were able to try to set up a testing site here at our health center in our parking lot here so that we could really find out what the true incidence or how many people in Charlestown actually have COVID-19, and then begin to really do more tracing and really figure out how to contain it so that it doesn't spread. So we opened up about 2 weeks ago, and we're starting to learn. We don't have a lot of data yet, but we will, and we'll really learn together about what the situation is in Charlestown. I do want to give the whole community of Charlestown incredible credit for doing all of the things that they were supposed to be doing to stop the spread of the disease. And that includes social distancing, really staying away from other people, face coverings, washing your hands, and we'll talk about this again. But all of those strategies have made an incredible difference in saving lives in Charlestown. So thank you. We've really kind of come over the surge and are on the downside now, as we know.
Great. And this is a good reminder here. relating to much of what we've been saying, that we don't know everything about this virus. And so areas where people may feel their certainty, there's often not a lot of certainty. And we've addressed a couple of those areas. And I think this makes that point, that there's a lot of research going on now, and we're actively learning as we go.
Yeah.
Excellent. So maybe we can talk a little bit about this, and then Sarah Coughlin, I think you probably have a few things to say. But I think you know, one of the myths that people may have as they're living with the fear and uncertainty of COVID-19 is that there's nowhere to turn for help, or there's not enough help out there. And New Health and the Coalition and MGH Charlestown are here to tell you that there is help out there, and there's plenty of it. And Sarah Coughlin, maybe you can mention a few of the things that you know are out there and you've provided for the community and connected them to.
Absolutely. I'm really happy to be here today, because we've been hearing at the community level, you know, this is several months into this. It's really surreal time in history, and we're scrambling as we're learning more about this and sort of how to handle it. And because of that, we're sort of hearing of so many myths in the community and trying to really get as much information to as many people as possible in as many languages as possible and as many means of in as many ways as possible, but we know that we're not getting information to everyone. And so this is just another way to try to get the messages out there of what the resources are, who people can turn to. We know that this virus is impacting folks in the community disproportionately, and there's a lot of fear in not only not having resources in the current moment with everything being shut down, but sort of what is going to happen in the future. Are these jobs going to be available? Is daycare going to be available? How is housing going to be available? Am I going to be back rent for months? Am I going to be in jeopardy of eviction? And there's so many questions and so much fear and angst. And so we want to make sure that we have as much accurate information in a timely manner as possible to get out to as many residents as we can. And so as a community of Charlestown, it's a 1 square mile community. We have a ton of resources. We're one of the most well-resourced neighborhoods in the city of Boston. But the challenge is that oftentimes those who need the resources the most are not aware of how to access those. And so we've been doing a lot of work to try to get that information in the hands of people that need it, but we have so many food resources available, so much so that I continue to say this in every meeting that we're on, but there should not be a hungry family in Charlestown during this time. And so if folks are not aware of the resources, I'm gonna just list the food resources. Currently, we have the Harvest on the Vine that's been doing amazing work for decades in this community, providing food to families in need, and they've increased their supplies and their times that they're meeting. They're meeting on Tuesdays and Saturdays, and have a lot of food available for folks. We have city resources that have the food bags for Boston Public School student populations. We have that over at Charlestown High and at the Kennedy Center. The Kennedy Center also has the YMCA food bags, the resources that they're handing out. They also received a ton of money from the city for the Boston Relief Fund, so have resources for food, the specifics for food for that. The Boys and Girls Club is handing out food on Fridays and hygiene kits at the Boys and Girls Club. And there's Fresh Truck that MGH is also available. Bunker Hill Associates is also doing food delivery for the elderly. So there's a lot of people working collectively around food resources for the neighborhood. For folks that are not aware of this, we're putting the information in all of the bags that are going out in the over by the Kennedy Center and the Harvest on the Vine, trying to get them out through the BHA population through door knocking and other ways safely. But if people can spread the messaging around of all of the resources available, we really have a ton of food resources. There's also on our website, which is charlestowncoalition.org, we have a COVID tab, and that resource guide is very thorough and it's updated daily. And it has all sorts of resources from housing to eviction rights to unemployment benefits to sort of for testing sites, all sorts of information, so people can go on there and check that site as well. Quinlan Locke, who's a city liaison and unfortunately is not able to be here with us today because he had a last minute call at the mayor's office, but he also sends out a very regular update from the city with citywide resources. As small businesses in the community begin to open up, there's resources available for assistance in PPE equipment to sort of get things off the ground. There is the Housing Relief Fund for rental assistance programs through the city. And so he sends all of those out in a very regular email. And so in a very regular way. So Quinlan Locke, and we can put his email and contact information as well if people want to get on his distribution list. And those are not only all of the resources, but it has information about testing numbers, so confirmed cases and where people can go to get testing, what to do if you have symptoms. So there's a lot of information out there. We just want to make sure it gets into the hands of the people that need it the most. And we want you to know that the community is here and will be here in the future as we try to make sense of this all and move forward. And not just with the pandemic, but with all that is going on in the world right now and all the pain and sort of historic movements that are happening in our country right now, that we're in this together and that we really want to help folks tap into what's available for them. So people can always reach out to the coalition, join our steering committees. We have very regular meetings every week, and they can reach me, scoughlin1@partners.org is my email address if you want to shoot me an email directly, and charlestowncoalition.org has all of our contact information and all of the COVID resources available as well. And if folks are watching this or hearing this that are out in the community and want to help, we've had a lot of desire for folks to kind of get involved and help. Charlestown's a very generous community with a lot of people that are willing to dedicate their time, resources, energy, and at this time we can use all the help we can get from folks. So please reach out, and there are ways to help tutor youth that are trying to graduate virtually. There's ways to kind of hand out food. The Harvest on the Vine often runs low on a few products that they're often in need of support of. So there's ways to kind of help in the community as well. So we're always welcoming new folks to try to get involved in the coalition's work. And just want you to know that we're here from you, and really happy to have Dr. Taraboga and Dr. Morrill here, because we're hearing a lot of misinformation. It's very scary. The information from the newspaper and the health center, it changes all the time. You know, sometimes the doctors are telling, or the world's telling us don't wear masks, and they're telling us to wear masks. It gets very confusing. It's hard to know what to trust, and what information to go to is accurate, and how do we kind of know what we're doing is best. How do we take care of our families during this time? And so it's a lot of fear and anxiety, and we want to make sure that those supports are there too. We also have a lot of supports to help with mental health access, because we know this is a really stressful time. Social isolation is huge for folks, especially within the elderly community and young adult community. And so we want to make sure that people are feeling connected as a community and that they know where to turn to. That's what we're here for. So please reach out to us, and know that we are working actively on recovery plans, and we realize the crisis is not over. It's sort of doing both, and sort of dealing with mitigating the crisis and all of what's going on in the world, but then also looking at how are we helping with recovery efforts and planning for that. We know this is not over, and the economic impacts of this are going to be long standing, and trying to get work as collectively as we can to apply for new funding for job training opportunities and resources to get folks employed after there's so many jobs lost right now in the community. And so there's a lot going on and a lot happening, but we just want folks to know that we're here, and that we want to do what we can to make sure that folks know what is available to them. So again, it's the charlestowncoalition.org. Reach out anytime and let us know. And if you're identifying needs that we're not aware of, please let us know as well. So thank you.
Thank
Sarah,
you, Sarah.
Sorry, go ahead, Ann.
No, I was just going to say thank you, Sarah. Thank you.
Absolutely. I echo that. And one quick follow-up. I know one thing that Ann and I have talked about, and we've both experienced, and I think many of our colleagues have experienced, is a concern that some community members can't access us virtually at a time when we're very limited. And we'll talk more about this, not completely limited, but a little bit limited on how many people we can see in person. And I know you've delved a little bit into some of the resources around what you need to connect to medical care virtually. And obviously you're not just connecting to medical care virtually, you're connecting to everything else, including many of the resources that you mentioned virtually. Can you say a few words about that in Charlestown?
Absolutely. I think there's a number of barriers that were getting in the way for folks accessing medical care. First, platform to do it. Some folks didn't have the technology. And so we're trying to make that available for folks. We have pots of emergency money that is available within the city and within the community that we can help folks with a material to do that. So we've given out some tablets within the recovery community so that people can access their providers. We're lending them out. And so if folks are in need of that, reach out to us and we can see if we can get one for you to use during this time until things open up for the long haul. We're working with Comcast as free internet service, and so we're helping folks get access to that. There's been some issues with back bills for some families, and we've been helping to mitigate the issues around that and direct them to the right pots of money that can sort of support families in that. A lot of challenges with accessing via phone. Sometimes you can only see a few faces on Zoom with the phone, and you can see more in like a tablet or a Chromebook. So we're teaching people how to use those and getting folks connected to those resources. We've seen a lot of challenges in accessing, like even knowing where to turn for that. And also within challenges with Zoom, I think for people that are unfamiliar with technology, it can be really challenging to get on a new platform. It's like a weird experience. How am I going to talk to my doctor on face-to-face? And it's just, where do I click mute and how can I get my video going? And so we created a one-pager that's a very simple explanations on how do you use Zoom, where is the mute button, how do you do a chat? And it's a really simple language for folks that Zoom is confusing for. And so that's been a really helpful resource to folks. We have that on our web page as well that can help people access that. And I'm trying to think if there's anything else. We've also been working on a policy level to make sure that a lot of these services are available for folks in terms of reimbursement and those kind of things.
Yeah, that's good. And just the two things I connect to that. One is from the medical system side, they're also advocating, a lot of folks at the hospital and at Mass General Brigham, which used to be called Partners Healthcare, the larger organization that we're part of, to try to make sure there's reimbursement for not only video virtual visits, which have their challenges for patients, but also can be quite effective with patients, but telephone virtual visits, not just video, but also telephone. I think there's a pretty strong voice to try to maintain that. And then the other thing is to have modes of information transfer from the healthcare system to the population, to people out in the community via text. So that if you just have SMS text messaging and don't have a lot of time, a lot of data on your phone, can't access websites easily, or at least not for long. There are new efforts to have information feeds with good information from MGH to communities. There's actually a new one we just heard about in certain communities served by MGH. I'm not sure Charlestown is in the initial list because I think it was communities that had very high rates of COVID-19, such as Revere and Chelsea, and I think also the neighborhood of East Boston. But then there's of course the city resource of the mayor's COVID texting system, which you can access in English by texting COVID text to a number that I can't remember, but we will put out with the minutes of this meeting, and it's in 12 languages. So you basically text a code, and then you can get on a list to be getting good information from the city about COVID-19. And we should also, and this is a good reminder on this slide, remember the 311 hotline for the city, which Quinlan was reminding us the other day is not just for parking tickets. It's not just, it's the way to tap into, if you don't know where to turn, just like the coalition, the city can help route you to the right resource within their whole firmament of all kinds of resources. And the first connection can be this 311 hotline number.
Totally.
Yeah, the other thing I just want to say, because it's just a whole new world for all of us, right? Where everything seems like it's shut down. I want you all to know we are open. We're open every day, and MGH High Street is open every day. We are here. There are people answering our phones. We want to connect to you, and we will help you through some of these challenges together. Like, we are really, really here. We have people on site. We have people off site who are answering phones and really present. All of the doctors, all of the nurses, all of the nurse practitioners are working for you. We're here for you. So you can just do the old pick up the phone and call, and we'll get you where you need to go. So that system still works too. Okay.
Excellent. Good segue to our next set of myths about seeking care. And I know, and you two as well, both Sarah Avery and Sarah Coughlin have encountered these myths in the past few weeks. Myths like, I can't go to the healthcare center. It's not safe to go there. I can't get anything done at the hospital. I need to put off appointments for my chronic conditions. I can't bring my kids in to get them vaccinated. It's not safe. And the whole system for mental health care, including addiction care, has shut down. Those are myths that we hear about all the time, and we are here to tell you that none of those things is true. And you want to comment on any of these? And
yeah, I'm not
go after
seeing
you.
it. Okay, yeah, here we go. Yes, please, as I was saying, we're open. We're here for you. It feels a little different. Just like going shopping feels really different right now, with the 6 feet apart. So our phones are open. We can we can talk to you on the phone like we used to do before. We'd call and we'd talk through things and we check in with you on the phone. We'll do that. And even more so, that's a priority because it keeps you safe and us safe in case people are sick with COVID. But we're also opening, as the governor has given us permission to open up slowly in phase 1. We are now opening and seeing more patients in our facilities, so people can come in for in-person visits, and that's wonderful. We all miss you too. We miss people. And the way that needs to happen, though, is very carefully and very slowly. So there's a series of screenings that need to happen at 3 days, at 24 hours, and then when you come in to the office, we will check because we want to keep you safe, and we need to also keep our staff safe. So this is true not only for us, but also for the hospital. The main hospital at MGH is open. They're doing surgeries. I've had a number of patients go in for elective surgeries in the last week. Things went beautiful. Everybody's doing fine. So, we're starting slowly and very carefully and very safely to reopen. And we need you all to know that. But it is a little different, just so you will get a lot of questionnaires that seem a little redundant, but it's just to keep everybody safe. The other thing is, when, we want to make sure you're checking in on your chronic medical conditions, please make sure a lot of that stuff you can still do at home and let us know. You can do your finger stick blood sugars. You can also if you don't have a blood pressure cuff, we can't promise it, but we're trying to get all these things to you so that you can also monitor your own health. You can exercise, you can keep healthy, you can keep doing those things to stay healthy and stay safe. Please, if you have children who need vaccinations, it is really important to come in and get vaccinated. That is safe to do during this pandemic. We are really worried that if we don't vaccinate, there may be a surge of another preventable illness in our children later on. So please, please come in and get vaccinated. Those were open for children to come in and get vaccines. Do not hesitate. And the other bigger issue is that, as just to echo a lot of what Sarah was saying and Jim Morrow was saying, is that we are all in this new situation. It's a very surreal experience. It's a lot of isolation. There's not as much connection. And we are all struggling, I think, with this new way that we interact with people. And so we are also here for mental health and addiction care. All of that is really working, and people are working really hard to be present and accessible for everyone. Jim, I don't know if there's other things you want to add.
Yeah, no, I think I could not say it better. I think that it is safe to come in, and this is a good summary here. We are here to grab your hand if you reach out, and that is true medically, and that is true for behavioral health and substance use disorder. Actually, during phase 1, as Ann mentioned, we are starting to see more in-person visits in a very careful way, but our goal is to ramp that up slowly and carefully and safely as we learn how to do that as a whole hospital and in each of our health centers. And the hospital has very careful ways, if you have symptoms that could be COVID, to get that evaluated at a separate type of site. If you've recently had COVID and you may still be infectious, to get your conditions evaluated at a separate type of site. And if you're in the middle and don't have either of those things, and we can accommodate you, you can be seen at our sites. And if it can't be an in-person visit, it can be a virtual visit, either on the phone or via video chat. And sort of all systems are go to try to take care of our patient populations at both health centers and at the hospitals. I'm just restating what Ann said.
And I'll just add in with,
yeah.
okay.
Mm-hmm. Please
No,
go ahead.
No, finish. I thought you were.
I want to say just one more thing, which is that they have actually given us instructions as health centers on who may need more of a helping hand, that we should reach out to. So just know as a community that we are actually going to be reaching out from our end as well to certain groups of people who actually may not realize they need to come in. And some of those are people with chronic conditions such as heart failure or kidney failure. Some of those, and this is actually prominent on the list, are patients with substance use disorder, who we are encouraged during phase 1, the very earliest reopening phase, to try to reach out to those patients and try to get them in. But also please spread the word. If you haven't heard from us and you need us, get in touch with us because we can see you. And go ahead, Sarah.
Yeah, no, it's a good segue because I was wanting to add to the addiction and substance use disorder treatment available, because I think there's a lot of myth that all programs are shut down, nobody can get into any programs, and it's just not true. There are detoxes available, there are TSS and CSS. It's small, it's harder now because people aren't leaving as quickly, but residentials are still accepting new intakes as well. So if people are needing trouble accessing that level of care for themselves or a loved one that's struggling at this time, our addictions and recovery manager, Shannon Lundeen, has been working nonstop around the clock for the last 2 months, and she's available too. If you go onto our website, all of her contact information is there as well, and we can help people navigate through those systems. There's also community supports available for the recovery community. There are meetings taking place, and we're trying to do it in a harm reduction and social distancing safest way as possible. But AA meetings are taking place in the community. We have a lot of virtual resources for folks for AA meetings and NA meetings. And there's also some in-person meetings that are actually taking place in the community. And so for those in urgent need of connection and all of that, contact us so we can let you know how to access those resources and how to obtain PPE for if you want to attend one of those meetings safely.
And Sarah, let me just add, we are also taking new patients. So if you don't have a doctor and you need a hand, we're here for you. We're here for you. Please call. These are extraordinary times, and we need to help each other.
It's important to say that both health centers have providers who are open and taking new patients. That is definitely true. Okay, so segueing over to some public health myths and realities. And one of the big ones I think probably all of us on this call have heard is that we're done, that COVID-19, we're over the hump. There's some time point coming up in the next couple weeks when we can just switch everything back on, and it's going to be over, back to normal. What would you say about that, Anne?
I think this is really not a sprint. We have endured 3 months. It's been really, really hard, but it is not over yet. We still need to be incredibly cautious and aware. We do not have a treatment yet for this illness. We are working on it so hard. All of the hospital systems, I mean, I just want to say that all of the hospital systems across the state, across the country, were working and testing to try to develop treatments. We do not have a vaccine, even though people are working at light speed to try to get vaccine. We do not have either of those things. And so the focus really does need to be on prevention. I know it's hard, but these measures do work. The physical distancing, the wearing of face covering, the hand hygiene, staying home if you're sick, all of those things really have made a tremendous difference. And they will continue to do so. And we all need to be diligent and take care of each other by doing these public health strategies.
Yes. These principles are still really important, and they're going to remain important for a long time, for many months, and maybe in some ways they're kind of always going to be important, and we now know how important they are. But at least for a number of these things, but these are all going to be important and paramount for many months going forward. We cannot let up on these basic principles. And the reopening that's happening, which is also really important, is going to be very slow, deliberate. And I just want to also mention that it's happening in lockstep in this area, in this state, this city, kind of at all levels. And that's actually been kind of an amazing thing to behold, that you've got the state with a phased approach that is mirrored by the city of Boston's phased approach that Quinlan talks all about in his regular email feeds as our mayor's liaison, and the hospital system, and then in concert with that, our health centers, our 2 health centers, we're all in lockstep with that same phased approach. And so what we're in now is what people are thinking of as phase 1, and kind of, I think that kind of cuts across all of these levels. They call it different things at different levels, but we're calling it phase 1 in our health system. And we're going to follow the data. And if the data says that things actually are starting to get better in some clearly measurable ways, such as number of new infections and hospitalizations and metrics like that, then we're going to click over to the next phase. That I think all the estimates that we've heard and the plans that we've heard are that would not be for another month from now, three to 4 weeks, let's say, from now. And it's going to be driven by the data. So that is a key myth to bust, is that there is some well-defined time point coming up when the switch gets flipped back on and we're done with this whole thing. Very important for everyone to hear that message. And then there was then there were sort of the mixed messages people were getting about masks. And I don't want people to think that we on this call are giving a mixed message about masks. I have my mask right here. Anne has her mask on because she is in a shared workspace. You can see the lofty ceiling of the shared workspace there. I am in a private room with the door closed, all by myself. I did hand hygiene and carefully took off my mask per protocol and laying it on a clean surface. And we'll put it on per protocol when it's time for me to do that. But the fact that we weren't using masks early on and are now just simply reflects kind of what we were talking about earlier about what we're learning about infection control, the magnitude of the pandemic, the types of mitigation that we have to put in place and maintain. And those 4 things that Anne mentioned that were the key ones. Are the ones we know now are really important, and one of those four is masks, and that's masks or face coverings when you go out. And many institutions have universal mask policies. All of MGH and partners facilities, including our 2 health centers, have a universal mask policy. So I think the four key elements, just to leave you with those, were physical distancing, masks, hand hygiene, and staying home when you're sick. Yeah, and it actually, the surfaces and contact tracing are really important as well. But those first four are like the core principles of mitigation. So now, no mixed messages about masks. That's a key part of all this. And then I think on the next slide, sorry, Sarah, I got to masks because I knew that was one of the myths. But another myth, it was about testing, that testing is scant, that there isn't testing available. And Anne and her crew are here to tell you that testing is highly available now in the city of Charlestown. You mentioned that in the neighborhood of Charlestown. Mentioned that a little bit earlier in the call, but do you want to say anything more about that?
Absolutely, absolutely. I just want everybody in Charlestown to know that any Charlestown resident can get tested for COVID-19 at our health center, New Health in Charlestown, if you have any symptoms or no symptoms, and especially if you've been in contact with someone who's tested positive. So please, if you do need an appointment, and the reason we ask for an appointment is that we want to keep everybody safe and have 6 feet apart and make sure there's no crowding in the area and the testing site. So we're just trying to make sure that that can happen. But you can call us or you can call MGH Charlestown. The numbers are there. We will get them out to you, and you just have to call and we can set up an appointment for you to get tested. We are happy to do that. It's really, we have an amazing team. Everybody's coming together and working on it, and we're here to just serve and take care of Charlestown.
Yep. We have a tight relationship with New Health Charlestown and a very smooth referral process from us to them. But you can call either health center to set up an appointment. If your primary care is at our health center, call us and we'll get everything plugged in. And also just want to emphasize that they and New Health are doing something very special for the neighborhood of Charlestown, which is not only are they going by the partners' testing criteria, which are pretty broad now, actually. If you have any symptom that could be consistent with COVID-19, or if you're a close contact of someone who has a known diagnosis of COVID-19, those are slam dunk. You meet partners criteria, you can get tested. But they're going beyond that, and they have made the commitment and have some financial backing to do so, and some partners who are helping them with this. To test anyone in Charlestown who wants to get tested, regardless of symptoms. So I wanted to just emphasize that message. So they're kind of going with the mayor's overall, vision for the neighborhoods of Boston, which is to try to get as broad testing as possible, and starting to talk, as other cities in the region have talked about, to a point of universal testing for anyone who wants to get tested.
Absolutely. Thank you, Jim, for emphasizing that.
Okay, and we may be getting toward the end. I just want to do a quick time check. But these are some myths that we've also heard, which is that somehow there's financial advantage to trumping up or making more of the COVID-19 pandemic than is really warranted. And we just wanted to be very, very clear in a unified voice across all 3 of our organizations that nothing could be further from the truth. That in fact, our hospital system that we're a part of has really taken a big financial hit from this pandemic, because they have done the right thing and really ramped down all of their non-COVID care. But they know that this is their role in the region, in the city, in the state, and they have the resources to be able to weather this pandemic and to help the region through it. So there really has been no financial advantage. I know of no, and I were comparing notes, we know of no kind of increased reimbursement for doing something like artificially diagnosing COVID or overcoding it. I think that one thing I will say is that we are really trying to be careful to find it, and all hospitalized patients at MGH are being tested for COVID, and it's sometimes there in the setting of other conditions that are causing morbidity and mortality in the hospital. I know one of my most tragic cases of the past couple of months was a man with alcohol use disorder and severe cirrhosis who came into the hospital with COVID that seemed to be a relatively mild case, but it may have made things worse with his liver and his kidneys, and he got into a spiral that ended up causing his death. And I think that the cause of death was his liver disease, but COVID may have been part of the picture. So we're trying to always be really careful, and I think people are also learning a lot more about COVID and how it can affect other diseases. So it does sometimes show up as a co-diagnosis now because of its prevalence in certain communities. Actually, this individual lived in Revere, which was at the time was experiencing a real surge in cases. So I wanted to make that point that it's sometimes showing up where we don't expect it. Anne or Sarah, do you want to say anything about these myths?
No, I think you covered it. I mean, I think because it's such a new process and what has needed to happen to take care of the large numbers of people who got sick with COVID. I mean, in some ways, I just want to say it was inspiring to see not only how Mass General worked, but how Mass General shared with all the other hospitals in the Boston community to really come together, share resources, ventilators, information, to really be able to take care of the sickest and the most devastating cases without regard to race or orientation or any discrimination. They really just embraced anybody who came in with any level of illness, of COVID illness, and gave them exceptional care. It was inspiring to see. And so many people, I don't know if people know this, but we were all kind of redeployed to work in other places that we don't normally do because we wanted to take care of patients. So nurses from our clinics would go help out in the hospital because there was a need. We went to work from Charlestown, we went to Chelsea to pitch in because that's where the need was. The entire community, healthcare community, really came together to take care of the larger community in a very inspiring way. And that was probably one of the most moving parts of this whole process for me. And I just hope you can all see that. I mean, the goal and the mission was really about taking care of our community and not thinking about the finances or the bottom line.
Couldn't say it better. Okay, and I think this may be getting close to our last set of myths, Sarah. And thank you for everyone for hanging in and being here, but we are busting myths as we go. And these last couple of myths sort of harken back to things that we, we're thinking about and talking about earlier in the presentation, which are around reopening. And Sarah Coughlin, do you have anything you want to mention about this based on what you've heard from the city?
Yeah, not much, just that we're following what is being told us, and it's changing by the minute, but that just to again ease folks' anxiety or fears that sort of it's going to be just a sweeping wide open reopen, or that all of these financial resources are going to abruptly end and people are going to be in really financial crisis. And so we're keeping a ear on what resources are available and planning for resources for the future. So how are we looking at different employment opportunities, different summer job opportunities for kids, just a whole host of things as we phase into sort of reopening, and that we're not only trying to mitigate the current crisis, but that we're really working together to try to think about how all of these organizations, all of these youth serving organizations, all of the faith-based organizations can really come together and plan for resource coordination for the future as we move forward.
Yep. And I just reiterate that idea of people in lockstep. And again, we're neither staying clamped down, nor are we just willy-nilly completely opening up and throwing open the doors, but we're doing this careful stepped approach. And I mentioned 3 levels: state, city, and health system. But I should also mention, and this slide reminds me too, it's also the nonprofit and community of organizations, of which the Charlestown Coalition is one of the organizing members of that group here in Charlestown. And so we're all working together here at all of these levels, community organizations, healthcare systems, city and state, and we're all moving in concert through this process of reopening, which is going to be very careful, but it's happening.
Yeah.
And anything you want to add?
No, except just to reiterate the last point. This whole experience, I think, has been humbling for all of us. And as we move to reopen, we all need to realize that things will change. The only thing constant in life is change, right? And we may need to adjust as we go. So it'll feel maybe one step forward, maybe we'll have to go a little bit back, but we're always going to be moving forward. This uncertainty is challenging for all, but we can really, really together make this work and be able to get over this challenge and be better on the other side.
And I think your last point, Dr. Taraboga, about being better on the other side, people keep saying, let's go back to normal. And I think normal is contributed to this problem. And so
Absolutely.
We want to be better than we're going back. And we recognize that there's a huge portion of this population that is affected more so than the majority of this community. And so we need to look at social determinants in a way of how are we valuing equity within our work and in our resources, in our housing, and in our employment, and in our economic mobility opportunities, and all things related to health and the well-being of our residents. And so we don't want to go back to normal. We want to be better than we were before this started. And oftentimes, it takes horrible crises to get the most growth and change. And I think we're in that part of time in the world right now where things are getting shake up, and we need everyone to kind of come together in ways that we hadn't prior. And so I look forward to seeing what we can do with the data that we've collected, with the awareness that we've, as the Center for Community Health Improvement, we've been aware of the impact of social determinants on health outcomes for a long time. And I think other folks are now getting more aware of that as well, in terms of policymakers and sort of bigger picture systemic issues that contribute to where we're at right now. So I'm hopeful in that, and I hope that we can come back as a community of Charlestown in a much better place than we were before this hit.
Oh, thank you for that, Sarah. That's absolutely true. Thank you. That's a beautiful way to close. You are right. Right.
Yeah. And I want to add my thanks to my co-panelists, to Sarah Avery for pulling this all together, and to everyone who's here.
Thank you to everyone.
Thank you very much. And I think our plans for this are to make this available as a recorded file that we can share around, and maybe put together some of the myths and realities point by point for people to kind of take home and remember. And also, of course, our contacts in our 3 organizations plus the City of Boston.
Okay.
So
Thank you all.
Thank Yeah.
Thank
Thank
you all
you.
for being a part of this.
Thank you so much
Thank you. I'm going to stop the recording.
for all you do. Bye-bye.
All right.